Good evening. Good evening, everyone. Can I encourage you to take your seats? Well, thank you for sitting down. We'll wait for some logistics. Our judging panel is getting its bottles of water. They have a quota of one. Please drink sparingly. Ladies and gentlemen, friends, good evening, and welcome to our first Big Idea Pitch Night. I'm Ishwar Puri, the Dean of the Faculty of Engineering at McMaster University. And for those of you who are visiting with us tonight and watching from all corners of the globe, welcome to McMaster, Hamilton, Ontario, Canada. It is my distinct pleasure to be your host and MC for the evening. This year marks 60 years of engineering excellence at McMaster University. In honor of this milestone, we are recognizing the big ideas that our friends, our alumni, our faculty, and students have perfected over that 60-year period. We've been celebrating all year with stories and events, including this one tonight. Tonight is a special night. For the first time ever in the history of McMaster, and certainly in the history of McMaster Engineering, students and faculty members are pitching their ideas on the same stage. We have 22 faculty members, undergraduate and graduate students, ready to share their big ideas to create a brighter world. You're all in this together as one big team. So, is everyone excited? Okay, this is being live streamed, so can we do this again? All right. So, is everyone excited? Nervous? Faculty members. Okay, nervous laughter. By the end of tonight, we'll name 14 winners, 6 faculty members and 8 students, and award more than $600,000 in research funding and cash prizes. This is the biggest cash award in the history of McMaster Engineering. We have a lot of big ideas to celebrate this week. On Tuesday, one of our alumni, Donna Strickland, was awarded a Nobel Prize in Physics. She's the first woman to receive the prize in 55 years, and only 3 in the history of the award. Strickland is a professor at the University of Waterloo. She was part of a team that developed short and intense laser pulses that have become an important tool for advancing science as well as finding applications in medicine and manufacturing. For those of you listening all over the world, we are so proud of everything Donna has accomplished and her work. It is our hope that her work inspires all of you tonight to think big. So on to the main event. How did we get here? Earlier this year, we asked faculty members to submit their ideas to improve the educational experiences of our students. The result was Educating the Engineer of 2025. 4 stellar proposals to improve education were awarded, and you'll hear from their proponents tonight shortly. The winners were selected over the summer, and they work on projects that are already underway. But as well, we are seeding big ideas. Seeding Big Ideas was a program that put out a call for research proposals. We've committed to funding 6 projects to the tune of $100,000 each. From more than 20 applications, a short list of 10 was curated by a blue ribbon interdisciplinary panel consisting of experts. You'll be hearing from 10 finalists tonight. But I have an addition. We're not going to give them $600,000. We're actually going to give $700,000 because 6 winners will get $600,000 at $100,000 each. And I like to please everyone. 4 of them will walk away with $25,000 each so that they're happy when they wake up tomorrow morning. As well, we've decided to bring in the big ideas of our students. On Tuesday night, 19 graduate students delivered amazing 3-minute theses about their own research in our qualifying round. Contestants were selected by their departments, and you'll be hearing from the top 4 later on in the program. They're competing for $6,500 in prizes. But it's not just graduate students. More than 40 undergraduate students submitted their big ideas to change the world for a chance at more than $2,500 in awards. 19 pitched their ideas during our qualifying round on Tuesday, and 4 will share their solutions with all of you tonight. I think I want you to understand one thing. At McMaster, we believe in the power of collaboration. We believe in the power of camaraderie as an accelerant and a lubricant. And that collaboration and camaraderie will become apparent tonight between our faculty members and our students. And maybe a little friendly competition as to who's better. This example, this event, is a great example of that. So how does tonight's event work? Our event is modeled after the famed 3-minute thesis. Each contestant is given the same essential guidelines, 1 slide, 3 minutes maximum, no props, no rapping or mic dropping. I'm looking at you, Tauheed, and that'll become apparent later. Just a great delivery and a great demonstration of the ability to communicate their ideas to a general audience. So let's begin by introducing our esteemed panel of judges who have the very difficult, I would say tough job of determining who will win tonight. And I'll ask them to stand as they are introduced, wave to the audience. You can do the Queen's wave or, So first up, tech giant Stephen Elop. Stephen is a Canadian businessman who has served in a variety of leadership roles around the world. Companies such as Telstra, Microsoft, Nokia. But more importantly, he holds a Bachelor of Computer Engineering and Management, summa cum laude, and an honorary Doctorate of Science from McMaster University in Ontario, Canada. Next up, Angela Pappin. No way. She's the Vice President Technology for ArcelorMittal Dofasco. Angela has held several senior roles within the company, including General Manager, Metallurgy and Quality, and others. But more importantly, she received her Bachelor of Engineering degree in Mechanical Engineering from... Come on, man. She received her Bachelor of Engineering degree in Mechanical Engineering from... Thank you. Some enthusiasm. Third, Lorna Summers, who's the Associate Vice President for Development. Lorna is recognized internationally as a teacher and trainer in the field of institutional advancement and strategy. She is currently the lead for the McMaster's Brighter World Research Initiative. Next, Nitin Chopra. Very nice. Nitin is a partner at Shasta Ventures, which is an early-stage venture capital firm. He's passionate about enterprise software and invests in infrastructure software, particularly in security and data technologies. He earned his Bachelor of Engineering degree in electrical engineering from a very reputable university, McMaster University in Hamilton, Ontario. And finally, Katie Porter. Katie is Director of Research and Administration for Hamilton Health Sciences. She provides strategic support to the Hamilton Health Sciences research enterprise. She holds an executive MBA from the Ivey School of Business at Western University and is also a regular lecturer at Mohawk College. But everyone tonight in the audience also gets to be a judge. We believe in democracy. So we'll be asking you to vote for your overall favorite pitch of the night out of our faculty members, student, and award. And for that, we have the People's Choice Award. You can either go to swiftpolling.com and enter in 1954, and I think that's all. At one point, I thought there was text messaging as well, but no. Go to swiftpolling.com and enter in N1954, and you'll be able to vote for the People's Choice Award. Now, finally, I want to say that we encourage you to cheer for your colleagues and friends. I mean, this should be like a friendly atmosphere. It's not serious. It's not the library, you know. So it's like what used to be called the Blue Lounge in JHE. So let's have fun tonight. Remember to tweet with the hashtag Big Ideas Pitch. And by the way, hashtags work as one word, so Big Ideas Pitch. And all engineers are excellent spellers, so you know how to do that. And a few house rules. Please enjoy the refreshments during the breaks, but try to remain quiet and still while the speakers are on stage. For our contestants, I'd like to introduce you to Hani, my good friend. Here's Hani. Hani is the timekeeper for tonight. You'll see that he has a clock. Hani, just stand. Just show everybody the clock. And what does it say, Hani?
It says the time that you have remaining.
Okay. So please also show our contestants your hand signals.
When you have 1 minute remaining, I'll put my finger up. When you have 30 seconds remaining, I'll do this.
So 1 minute remaining, 30 seconds remaining, right? So lastly, before we begin the official program, I want to acknowledge some special guests here in this evening from McMaster University. First up, Mike Play from Play Consulting and Dean's Advisory Board member. Mike, this is your chance to do the wave. Mike is the chair of the Dean's Advisory Board. We have Doug Barber. He's a member of the Dean's Advisory Board and past chair. That's right. Chandra Kutsia from Mantris Incorporated, and he's a member of the Dean's Advisory Board. Christine Amarkian, Global R&D Consulting Group Incorporated, and a Dean's Advisory Board member. Welcome. Gina's here, Gina Suchi, West Hill Innovation, and a new member of the Dean's Advisory Board. Art Heidebrecht, former Dean of Engineering, Provost Emeritus at McMaster University, and a member of the Dean's Advisory Board. Carol Wilson did not come as yet. Okay. Now, Len Waverman said he would come, but I don't see him. Len Waverman, can you come to the front? Because Len is a friend of mine as well. Dean Waverman, just come and wave at everyone from here. Dean of the DeGroote School of Business. And finally, there's a story behind this, John Bandler. John Bandler came to my office and said, we should have 3-minute thesis. And I said, that's a great idea. I said, John, let's do it with undergraduates as well as graduate students. He was talking about graduate students. He said, yeah, that's a great idea. I said, let's do it with faculty members. He said, oh, you'll never be able to do that. Here we are, John. John Bandler, Professor Emeritus, and his wife, Beth Bandler. John has been instrumental in coaching many of our contestants tonight. So, first up, we have our 4 Educating the Engineer speakers who have offered a range of ideas to improve education for our students. Each project received $20,000. Tom Doyle, first-year engineering design integrated cornerstone.
As engineers, we look at the world. We look around us and we try to engineer it to be a better world. In that view, I would like to talk to you about our project, Engineering Education. My name is Tom Doyle. I'm the first teaching professor in the Faculty of Engineering at McMaster. I've been here for 15 years teaching our first-year engineers, teaching all our engineers. It surprises me I've been here that long. My philosophy in teaching is that students should synthesize their knowledge through design education. And that belief is born out of my own educational experience. For me, the capstone, my senior design, was where I learned to integrate all of my knowledge. And it's that experience, it's that feeling of pride, of success, of accomplishment that I wanted to give my students. But I don't want them to wait 4 years. I want them to know it right from the beginning. So what we propose is a design project called the Cornerstone. And the Cornerstone is like a capstone, but it's geared specifically for first-year students. The objective being is that we give them the same experience, but we scaffold it. We create it so as they can achieve it. Now, the objective with that is so that we can have our students with a sense of pride for their education. Our objective is to take that, this is much harder than it seems. Our objective is to take that and go with our students, and it ticks much faster. Okay. Okay. So, what I wanted to do is I took my students and I have them create a prosthetic, and that prosthetic is created from a gear train. They simulate the design and they 3D print it. The objective being is that they can take that and show it to other people. This objective is of course something that we all have very good instructors. We all have people who are teaching courses, but we're doing it traditionally. We're doing it in a traditional sense that's parallel. What we propose is an integrated cornerstone. We propose with my colleagues to take our courses in programming, in materials, in practice, and design, and have that integrated into a series of cornerstone-like projects. With that, we're going to study their technical skills, their leadership, their communication, and overall their sense of pride in their work. We believe that engineering a better world is going to require engineering a better integrated education. Thank you.
Kim Jones, incorporating inclusivity in the engineering experience.
Thank you very much. I do have pneumonia, so I'm going to sit. No, they'll be fine. I would like to point out that IDEAS has the words inclusivity, diversity, and equity within the word itself. So I'm going to sit on equity today. When I was growing up in the 70s, my mom was a very ardent feminist, and she would have been happy with the idea of equality. But equality is giving only people the same opportunity. It doesn't mean that they have the same experience. So at McMaster in engineering, we're aiming to give our students both not only an equitable experience where they have the same opportunities, but an experience of justice where the barriers come down altogether. So the project I talked about had three major ideas. The first was to enhance the teamwork experience. So there's certainly been research in the past that has shown that women in particular are driven away from engineering because of their experiences in teamwork. If you're in a team that doesn't value your ideas and that gives you the non-technical components to do, it isn't a particularly motivating experience. So the first objective was to ensure that that doesn't happen to any of our students. The second one is that one of the issues with equity and inclusion and diversity is that oftentimes we end up preaching to the choir, listening to the people, or talking to the people who already believe that equity, inclusivity, and diversity is important. So how do we reach out to those other people? And our idea was to have a series of very small courses on leadership that explicitly include the idea of inclusion, recognizing that everybody values leadership, but leadership won't be effective unless every member of the team is valued and has their ideas heard. And then the third and final idea was that we would actually have a course on inclusivity in the engineering workplace. And that course would perhaps preach to the choir, but give both allies and those who might experience a more difficult time in the engineering workplace an opportunity to really explore what the issues are, but also what some of the solutions are. So we hope with this three-pronged approach to really ensure that our students have an inclusive experience while they're here, and that they can bring that same level of knowledge and caring out into the workplace to change the world. Thank you very much.
Mike Justison, Flipped Classroom Finite Element Analysis Lab.
Thank you very much. I'd like to take you back to 1967. Well, I can't actually take you back there, and it's, of course, very far before the time I was born, very, very far. But something very special happened that year. There was a Canadian academic, writer, and philosopher named Marshall McLuhan, and he published a book, and the book was titled "The Medium is the Message." And what he meant by that was, very often, the way we convey information is as important as the information itself. And I want you to just keep that in mind for a moment. This idea came to mind for me last week. We had a visiting professor from MIT who came to speak to us about how they went about developing a new engineering program at MIT. And of course, they did the normal things, which is engage with the various stakeholders like the students, the faculty, alumni, industry. But what caught my attention was the main focus was for them to engage with what they called thought leaders. And I thought, thought leaders, that's a great job, isn't it, to be a thought leader? How would you go about engaging with thought leaders? And how MIT went about this was to go to YouTube and watch TED Talks. And I thought, the medium is the message. So for us, in education, when we have a guest speaker come from a very prestigious school to talk about the content, well, we also have to think, what did they do? What did they do to gain information? And it was really watch recorded video content. And it strikes me that we all have access to thought leaders in all fields at any time on demand in our pocket. So for us, in this course, it seems like it's a very sort of modest sort of task in comparison to the big idea of recorded video in general for education. But what we'd like to do for this course is to have students create recorded video content that other students can access. We'll use that video content to sort of highlight the easy things about learning finite element. How do you load a file? How do you get started? How do you create a mesh? So that when the students come to class, they can spend the time better with the instructor or the TAs to learn more advanced topics. So that when those students go to a job interview and they're asked the question, do you know how to do finite element analysis? They'll be able to say yes, rather than just say, well, I know what it is, but I'm not sure. So anyway, that's our big idea. Thank you very much.
Liz Hassan, Expanding Experiential Opportunities.
Hi everyone. So I'm a assistant professor in mechanical engineering, and there I am in 2002. You can see my natural hair. Yeah, we've come a long way. But the other thing that you can see is that I'm sitting on a race car that I built the chassis of, and so that's what I did in my third year of undergrad. That was a pretty important task. It was a transformative experience, being the body and chassis manager of that vehicle team. And so that's at the Formula SAE competition in Pontiac, Michigan. And so there is my student Megan. And so the link between these two photos is that now I teach the things that I learned when I was a member of that team. So I teach CAD, and I even teach a course that gives course credit for participation in these teams, Engineering 4EX3, and Megan is one of those students. She's a member of our award-winning EcoCar 3 team. And so she is now a member of Ali Ahmadi's award-winning automotive research group. So for around 20 years, and actually even longer than that, we've been having these really transformative, hands-on learning experiences, primarily for mechanical and electrical engineers. And so we know that these really do work exceptionally well, because the big three automakers recruit really heavily and sponsor these competitions lavishly. Because they really are the perfect training for a young engineer. But things are changing, and so the kinds of technical challenges that our students are going to be facing, they aren't just automotive, they're not simply mechanical anymore. They're inherently interdisciplinary, and especially here at McMaster, we're the school of and so we have mechanical and society, or integrated and biomedical engineering. And so the future of competitive teams is probably not a car. It's probably something like perhaps challenging Harvard for exoseat supremacy. That's my friend Paul from the Wyss Institute. And so, perhaps the future of these teams looks something like that. And so my research program is around figuring out exactly what the future of these teams look like so that we can extend these transformative experiences to everyone, no matter what their discipline, and to also study the logistical factors that might prevent students from engaging in these team activities as fully as they might like to. And so the combination of these two factors should combine to make us a national leader in this field. And so, sorry about that. And so, the combination of this is so exciting. We don't really know where it's going to go yet. It really depends on our students. But I, for one, am very excited and delighted to find out where it does end up. Thanks very much.
So please join me in offering congratulations to all of our Educating the Engineer of 2025 winners. So. And now on to the main event. We have 10 faculty members ready to pitch their ideas. These ideas had to be big. So big with like a capital B. They had to be collaborative. So you couldn't pitch an idea on your own, you had to have a team. And they only had 3 pages to present the big ideas. Each faculty member today has 3 minutes to present their ideas, followed by a 2-minute Q&A session with our judges. First up, Todd Hoare, Chemical Engineering, 3D Printing of Organs.
You know me all too well, Greg. Yes. Technical issues. A way to make me more nervous. Thank you. I really needed that.
It'll be a 2-minute break.
Okay.
So I'm going to explain what's going on. So the thing is, this is McMaster University. We're projecting worldwide. We're talking about McMaster engineering. And there comes Mike Justison. He starts talking about MIT. And so Todd Hoare went and did his postdoctoral work at MIT. And this is the way of the branding gods to get to the technical system so that his slide doesn't come up. I'm out of jokes, you'd better. It's being solved. So when all else fails, a system reboot. So I think I just heard the reboot, the Mac reboot jingle. So well, I mean, this is a good time. Look to the left, look to the right, make friends with people. Oh, Carol, was going to introduce you. This is a good time. Carol Wilson, member of the Dean's Advisory Board. Yeah. Sure, Shelley. So they've already been awarded the funds, and I believe they have the funds, Mike? You don't think so? Nancy, can we make sure they get the funds? Okay.
Yes, we do have the funds.
Oh, he just wanted some more. So Mike, when are you going to conclude your project, and when can Shelley learn about the outcomes? Probably this time next year. So if we do this again this time next year, let's have, 1-minute deliverables. How's that? Okay. Thank you very much, Shelley. Okay. We are good, but it still says big ideas pitch. And so I just, there you go. Todd Hoare, 3D printing of organs.
The picture at the center of our slide is that of Robin. Robin's a friend of mine, and in 2009, he was diagnosed with acute liver failure. After 18 months of suffering, he got a donor organ, but he was one of the lucky ones. Right now in Canada, there's 4,500 people waiting for a donor organ. And every day, one of those patients will die waiting for an organ that didn't come. I'm Todd Hoare, and on behalf of Ravi and Boyang, I'm very pleased to present our big idea to help patients skip the line by printing the organs they need when they need them. This is obviously a really ambitious idea, although there's a lot of momentum behind this idea now worldwide. So why do we think we can help? Well, to explain that, I need to explain a bit about how to print an organ. First, you need the right cells, and you need to make them communicate. Boyang is a co-founder of one of Canada's leading organ-on-a-chip companies. He has the clinical connections and the expertise to do just that. We've also made strategic partnerships with colleagues in health sciences who are experts on those particular organs, which will help us advance our goal. Second, you need to give cells a scaffold in order to guide them and give them the cues to make the tissue you want. That's where I come in, by making biofunctional hydrogels that can gel on demand. Think the hydrogel equivalent of epoxy glue. By using our patented materials, we can address some of the issues around the mechanics, stability, and printability of hydrogels for printing. Third, we need to spatially arrange the cells and the scaffold in a precise orientation that resembles an organ. That's what Ravi does, by integrating different additive manufacturing strategies together in a single printing process. Now, while ultimately we want to print complex organs, we won't start there. We'll start by printing simple 1 or 2 cell tissues, things like cartilage or airways. Incidentally, both tissues that are hard to print using current technologies. We'll then use those model tissues to predict patient-specific drug responses. Think personalized chemotherapy for cancer patients. We'll also print cell bioreactors so that cells can be implanted in patients and produce therapeutics as they're needed. Think insulin for diabetics. Both of these in themselves have huge clinical potential, and they're also of huge interest to our industry partners, all of whom are very interested in helping us push our technology to market once we prove it works in the lab. Finally, by linking our expertise, McMaster's expertise in additive manufacturing, and the clinical expertise in the Faculty of Health Sciences, we see a huge opportunity here to catalyze new interactions and partnerships, and also to form a network, starting at McMaster and extending across Canada, of people focused on solving both the engineering and biological questions around 3D organ printing. We don't think patients like Robin should have to wait. And we believe our team brings a unique perspective to this problem to take 3D organ bioprinting from a big idea into a clinical reality. Thank you.
Questions from the panel?
Yes.
Katie?
Todd, great pitch.
Thank you.
Huge promise in the 3D printing of organs. This sounds like you want to establish a really robust and interdisciplinary program of research here at MAC. Do we have other peers at other universities in North America or beyond that are doing this well that we could learn from and potentially collaborate with and scale this?
There's certainly a program at U of T, more around the organ of the chip, so they have a collaborative program based there. In Canada, we're a little bit behind the curve, I think, on this, though, to be quite honest. There's certainly programs in the US and Europe, places like UCLA in particular, that are really active in this area. So there's a little bit of catch-up, but I think the benefit that we have is that we each bring sort of a unique technology that no one else has to this problem. I think that's really the pitch we want to make.
Lorna, Stephen?
Is it a case of industry, or sort of catch up with your industry partners that you've proposed? Would that be partners in Canada or globally?
So we have 5 companies there. 4 of them are Canadian companies who want to do partnerships with us. So certainly I think academics and industry are sort of working hand in hand on this. A lot of the companies are a spin-off of university labs in this area, so I think there's some synergy to be had there.
I think everyone in the room can relate to the incredible value that this work could lead to. But in the one sentence in your proposal, you go from nascent developments that are promising to a pursuit of the manufacturing of organs with all of their biological complexity, which is a moonshot.
Sure.
What are you actually going to set out to do?
Well, in the scope of this grant, what we really want to do is integrate the 3 key technologies we have. So my printable hydrogels, Ravi's sort of collaborative additive manufacturing process, and Boyang's ability to vascularize tissues and build up their complexity. So we each know how to do those individually. We want to put them together. So if we can prove we can do that, keep cells alive, have the cells do the same sorts of things we would see in an organ, I think that would be a success from this, and it would lead us to the next step.
Todd, thank you very much.
Thank you.
Catherine Granfield, Material Science and Engineering, Smart Surfaces for Combating Antibiotic Resistance. Catherine?
Hospitals are where we go to get better, but you may know somebody who's gone to a hospital only to be exposed to a bacterial infection. Well, unfortunately in Canada, this is quite common. 1 out of 9 patients admitted to hospital in Canada will acquire an infection. And what do we do when we have these infections? Well, our first response is antibiotics. But what happens when they don't work? Superbugs, or antibiotic-resistant bacteria, meaning bacteria that don't respond to antibiotics, are on the rise. And hospitals are not the only place they can be found. Something as simple as touching a doorknob could expose you to these bacteria. So what do we do to protect ourselves and our society's most vulnerable, our children and our grandparents? Well, I'm Catherine Granfield, and I direct a lab here at McMaster focused on advanced microscopy of biomaterials. Along with my collaborator and co-applicant Leila Soleimani, an expert in materials fabrication, and our collaborators in health sciences, we have the solution. We propose a radical shift in thinking. Rather than focusing on the development of new antibiotic therapies and treatments, we propose a preventative surface engineering strategy. Imagine if we re-engineered the surfaces around us, our personal electronic devices, medical equipment, even implants inside of our body to repel and kill bacteria. Well, this is what we envision. New studies show that using nanotechnology, we can have surfaces that repel bacteria. And by nanotechnology, I mean surface structures that are 1 million times smaller than the head of a pin. So if we incorporate this into our devices, we could kill and repel bacteria. But there's some key questions. What is it about these nano features that kill bacteria? And why don't they kill all forms of bacteria? Well, the answer is simple. We just don't know because current technology does not allow us to see both the living bacteria and nanostructured surfaces at the same time. This is where our research comes in. We propose to use a new imaging method called liquid electron microscopy. This will allow us to see both living bacteria and nanostructures at the same time. We'll be able to identify and understand what it is about these nanostructures that kills bacteria. And then next, we can apply this to the creation of a suite of universally antibacterial surfaces to kill all forms of bacteria. So our big idea is not to create one product. It's to create a technological platform for the understanding and development of a range of new materials, from medical devices and equipment to infrastructure, such as doorknobs, to save lives. Thank you.
Really cool, great presentation, thanks. You touched on all the surfaces when we go to the hospitals, and Canada has a big issue with that. So what's that's a pretty big surface area to cover, right? How are you actually thinking about sort of scaling this? It's like, how do you actually roll this out? Because, it's like you're only as strong as your weakest link. You don't want it to be, solve a part of the problem and just doesn't get anywhere. So how do you kind of think about that from a rollout perspective?
Absolutely. I think if we're thinking of a rollout perspective, what happens in hospitals now is there would be quarantine areas where these bacteria and infections are. So that would be the critical place that we would start to roll out this type of material. And we can apply it to all types of material, metallic materials, polymeric materials. So we could think the key surfaces that people are touching in the room, healthcare professionals when they're coming in and out, and family members if they're also allowed in that space. So that's where we would focus our first step.
This somewhat reminds me of no-stick frying pan surfaces, and you spray the stuff on or whatever. It might be oversimplifying, but in that case, a particular company owned the intellectual property and somewhat narrowed the application of the technology. How do you view that IP would be managed so that something as profound as this could be broadly applicable?
Yeah. I think that's a great question. So what we intend to do is the first stage of the problem is really understanding how bacteria are killed by nanostructures. And there are some surfaces that like you said, are slippery surfaces and things don't stick to them. But this doesn't work for all types of bacteria. So we think that there's a unique combination that we will come up with that we can protect with IP that will really target all forms of bacteria. This could have nanostructures, nanoparticles, therapeutics. So we believe that there's still room in this space for IP.
Quick question.
Sure. I read your proposal, and you mentioned you're going to train highly qualified personnel and publish in leading publications, all great academic pursuits. How are you going to leverage those to engage some industry partners when you want to scale this?
Yeah, that's great. So
In 2 seconds.
We have two approaches, the fundamental approach and the applied approach. So we'll work with our collaborators in industry to help them. We have several in electroplating companies who are interested in moving their processes from automotive to
Perfect.
other areas.
Thank you. Igor Zitorsky, next generation of printed and flexible electronics. Next Print Flex. Igor?
Ladies and gentlemen, our objective is the development of Center of Print and Electronics at McMaster University and development of new generation of functional devices with advanced functionality. The market of printed electronics is growing, and major drivers of this multi-billion market are flexible displays, flexible photovoltaic devices, flexible supercapacitor batteries, sensors, antennas. Could you imagine if your dress can change color during the day and equipped with the communication devices with Bluetooth technology and different sensors? Unfortunately, not all the functional materials can be printed. Only limited number of materials can be printed, and the major problem is ink, chemical stability of ink. Our recent discoveries and our recent development of our team paved the way for technological breakthrough in this field. We developed advanced techniques for synthesis of nanoparticles. We developed advanced techniques for dispersion of nanoparticles. We developed inks with superior stability which outperform other inks. We developed techniques to make inks which cannot be prepared by other techniques. This area offers amazing opportunity to combine efforts of different researchers with expertise in material science, nanotechnology, chemical engineering, electrochemistry, with expertise in engineering physics, electrical engineering, colloidal science, surface science, mechanics, robotics, and other fields. Leadership of McMaster University in this field offers amazing opportunities in development of new products, commercializations of new products, new applications. There are exciting opportunities for our students for future jobs in this field, and there are exciting opportunities for development of startup companies. We have strong support of industry, including support of IntelliFlex Alliance, which combines efforts of 300 companies across Canada in the development of printed electronics. Thank you.
It seems like your proposal is to build a research center. What do you actually want to get out of the first grant and the first cycle of work that you would do besides just the creation of a research center?
We have plan of this research. First of all, at this stage, we have something that we can propose to companies immediately, because we have inks with superior stability, and we can help companies to develop better products. Second of all, we are planning to purchase equipment and print devices here at McMaster University and provide support to new companies. And finally, we are going to develop new products with superior functional properties, which using our techniques, we can achieve superior stability, and we can disperse, we can make inks which cannot be prepared by other techniques, and it offers unique possibilities in development of new devices which are currently not on the market.
Thank you. Just a question, are you leapfrogging anybody? So is this happening anywhere else in the world, or do you believe that this is a leapfrog idea?
There is already a strong market of printed electronics. It's good for us. Just we are going to enter this market with new ideas, with new generation of printed electronic devices.
In your proposal, you talked about 4 industry partners that I've already kind of talked to.
5, yeah.
5, I might have missed one then. When I looked at their websites, all of them seem to be really small companies. And do you have a sense of like how big those organizations were, or their other partners were just starting? I'm a little bit just looking through it. It was a bit of a concern that, you know, what's sort of the industry pull, and that might be just reflective of what we looked at.
There are many other companies which also interested in our collaboration. We have many discussions during the last few months with different companies, with large companies, and we will help to small companies and large companies, and we will develop advanced products for
Thank you,
many
Igor.
companies.
I'm on the clock. Zara Mutamed, development of a predictive tool for cancer metastasis.
In this room, 1 in every 4 of us will die from cancer. From those, 90% will die from metastasis. This is very unfortunate, but for sure affecting all of us, our families and loved ones. In metastasis procedure, the cancer cell detach from the primary tumors, enter blood flow and attach to the new location and form the secondary tumors. So the figure on the left actually shows a patient with cancer metastasis in a very late stage. So this actually is very dangerous picture. This is a very scary situation. This image shows that the patient will die soon. We want to prevent this to happen. I am Zahra Motamed. I am assistant professor in the Department of Mechanical Engineering, and my big idea with the other collaborator is to develop a patient-specific tool to predict cancer metastasis. So now it was demonstrated by many researchers that more than 2/3 of metastatic site can be explained by blood flow dynamics between the primary tumors and also the secondary tumor sites. So we are going to develop a predictive tool to understand and to predict the secondary tumor sites. So within that one, we can actually predict what's going on. The idea is the following. As you see in the picture, the patient walks into the clinic. We are going to do MRI and CT with contrast agent to collect very high quality images. From there, we are going to reconstruct the 3-dimensional model of the entire circulatory system using image segmentation algorithms that we are going to develop. And also, we are going to develop multi-scale computational fluid and solid dynamics module to investigate transportation of cancer cells and also arresting the cells. So with that understanding that we can predict the secondary tumor sites in cancer metastasis, the clinician can monitor the patient more effectively. They can apply and use targeted drug delivery, targeted radiotherapy, and also they can use other innovative and actually novel therapies to treat the patient timely and preventing cancer metastasis. Thank you very much.
Thanks very much. Could you tell us how you're working in collaboration with any of the individuals, faculty, clinicians in the Faculty of Health Sciences?
Yes, for sure. For doing actually this project, we need people from different backgrounds. So I am mechanical engineering with the expertise of medical imaging and also computational modeling. We have actually Dr. Maureen McDonald, Dean of Science, and also Dr. Shahram Shahriari, that both of them that have expertise on medical imaging, and also Dr. Spencer Smith is on board from Department of Computing and Software. But also, I am working a lot with different collaborators, clinical collaborators, in terms of getting the images, clinical images, and also with other companies. So regarding the fundamental, we have a team that's working on medical imaging, computational mechanics, and also computing and software.
Thanks, Zara. I had a question regarding something that you just said. It sounds like your technology could be an asset to other types of companies like drug delivery firms or medical imaging companies. I was wondering if you are working with them now to refine your technology to really, build and scale your concept.
So actually, there are some companies right now, they are on board. But none of them, they are medical imaging companies, but for sure, for example, companies like Siemens, Philips, so for sure, they should be actually of interest, financial interest. But we are working with some companies that they have expertise on cancer and drug delivery right now, and also with other clinical collaborators. But for sure, it could be interesting for medical image companies. It could be interesting for actually drug delivery and also for robotic surgery. Some companies like this.
Thank you very much, Sarah.
Thank you.
Technical issues and we need to go see more meeting.
So do we have a pause? Yeah. Okay, Hani has a technical issue and he needs a power cord. He's out of battery. mean, there's no big idea, unfortunately, today to solve like battery life, so which is unfortunate. So this is a break. Please mingle and don't get up, but like, just talk to the left, talk to the right. Is it going? Okay, we're ready to go. We're ready to go. If you want to know the real reason, I just found out the real reason why the clock crashed. So we're really cheap. We got the trial version of the app. So Hani just went.
Not me. It wasn't.
So Hani just went and bought it. So. So we're okay now. Okay, so note to all of you, if you're doing something in the future, just buy the app. How much was it?
I think it was $5.
$5. Okay, ready to roll? Tauheed Didar, tackling food waste. Tauheed?
How often do you check the expiry date on a food packaging and toss it out if the date has passed? Sounds familiar? We all do that, right? In Canada, we toss out $31 billion worth of food every year. And not actually all of this food is spoiled. In fact, about 1/3 of the food produced in the world is wasted due to poor quality control during the production, transportation, or consumption. Then again, you can't really blame the consumers. More than 400,000 people die every year because of food poisoning. You can't really blame the manufacturers either. Should something go wrong, they lose a lot of money because of food recalls. $55 billion in 2017 alone. So is the only solution to toss out potentially good food while nearly 800 million people are living in hunger? No, we can do better than that. Hi, my name is Tauheed Didar, and our mission is to make food safer for a longer time. My team has recently developed a unique technology, a transparent, tiny, flexible patch that reports to you the presence of E. coli, a nasty bug, inside your packaged meat without the need to open the packaging. This technology received a lot of attention from the mainstream media worldwide, including our own CBCs, the national, and many national and multinational companies. This pitch, though, is just the tip of the iceberg. With support from this funding, we will establish an interdisciplinary research platform in Canada led by McMaster to develop the science and technologies that will allow us to screen the food for a wider range of contaminants, not just E. coli, so that everybody in the food supply chain can use it, even you at home. In addition, we will add temperature, pH, and humidity monitoring, and pack all the sensing and signaling capability into a single color-coded barcode so that you can screen using your smartphone. We envision that these barcodes will replace the current barcodes on all food packaging with our slogan underneath the barcode that reads, "Scan me before you eat me." Thank you.
Thanks, David.
As someone who's never checked anything that's expired in her fridge, this sounds like a great idea. It's a surprise I'm alive if you've seen my fridge. But this is wonderful. I'm just thinking, you know, I shop at Nations and I'm getting food from all over the world. This would attend to a problem of some of the food that's produced and is scanned. But what about your consortium or your platform? You're starting with Canada. Is your aspiration to be worldwide at some point?
Yeah, of course. Actually, most of the companies that contacted us after the technology came out are multinational companies. And the idea is that not only you can track the pathogens and the humidity and temperature, you can actually track the source of the food as well and pack all this information into a barcode so that you can easily scan it. And also, you can add this, basically a safety check, a yes or no mark on it, so that even you don't need to use your cell phone to scan and see what's going on. So yes, we want to track the food where it originates and where it basically tends.
So my question is, have you thought about, can you expand this beyond the flexible packaging side of things?
Sure. So this research platform will help us use these surfaces in a wide range of settings. Hospital surfaces. We're thinking of producing sprays that you can spray on any surface and in a minute would tell you if there's a bacteria on that or not. And we're trying to change this. I only had time to present the food because the story also read well with that. But the idea is to have a wide platform here so that you can use it as a spray, as flexible surfaces, as you know, instruments in surgery for hospitals, so that you can actually find out if there's any contaminants in any of these surfaces.
Tauhid, thank you very much.
Thank you.
Zoe Lee, piloting the vision of climate-resistant smart cities at McMaster.
I believe some of you still remember the ice jam in Brantford earlier this February. The ice jam flood increased the water levels of the Grand River by over 3 meters and forced 5,000 people to evacuate from the community. This past summer, heat wave smashed records all over the world. And just 2 weeks ago, Ottawa was hit by devastating tornadoes. Those are only a few examples of what we call extreme weather events due to climate change. These extreme weather events could easily cause significant damage to infrastructure, and that is why building climate-resilient cities is an urgent need. Now, instead of climate resistance at the city level, let's take a look at our problems on campus. That is a picture of our students canoeing in front of JHE after a storm in 2013. And flooding also happened near McMaster Hospital in 2016. The streets were completely flooded. Well, personally speaking, I will give birth to my first child in that hospital in less than a month, so I would hate to see that happen again. And other than that, there are many climate risks on campus, such as wind damage and overheating problems. So our big idea is to start from our own campus and pilot the vision of climate-resilient smart cities at McMaster. We are a team of 3 civil engineers and 2 data scientists, and we're proposing to first carry out vulnerability assessment so we can identify the most vulnerable elements on campus. And then we'll generate reliable climate projections using advanced AI techniques so that we will know what kind of extreme weather conditions we should expect in the future. And finally, we'll find cost-effective solutions to infrastructure adaptation so that we will know how to protect campus infrastructure against those extreme conditions. Eventually, we would like to extend our solutions and findings and help build climate-resilient smart cities, because we all know McMaster is just like a mini city. We won't be the first in the world to do this. Actually, Harvard, MIT, and Cambridge, they're already doing this. But if we start right now, we will be able to build the first climate-resilient campus in Canada, and that will place us in a leading position for infrastructure adaptation in the face of intensifying climate risks. Thank you.
First, congratulations and all
Thank
the best
you.
for your first child.
Thank you.
Kind of my only question is your comment towards the end. It's that it sounds like there's a couple other initiatives. What's specific about this particular research that helps you sort of leapfrog those, and why do you think that you have an edge in that?
Yeah, so in our project, we want to focus on infrastructure. So there are some climate action plans all over the world, but they mainly focus, there are general guidelines that focus on energy consumption and things like that. We want to focus on infrastructure risks, and because we have 3 civil engineers on the team, so that's what our focus will be. Thanks.
While we would all worry about the potential risk of ravages of climate change on McMaster, are there not some better places to apply that effort, either more broadly in the Hamilton region or here in southern Ontario, where the research would have a greater impact? Perhaps worrying about water supply, or you mentioned the Grand River. McMaster looks like a relatively safe and benign place relative to those.
Yeah, that's a very good question. The reason we choose our campus is because we are all in this campus. And this campus is like a mini city because we have infrastructure, we have utilities, we have landscape. To us, it's a very good starting point for us to analyze the impact on those on the infrastructure. So that's why we decided to start with from our campus.
Zoe, thank you very much.
Thank you.
Chin Fang, robotic precision nanosurgery. Okay, thank you.
The 3 minutes thesis is pretty tough. Somehow I have an idea of 20 in my mind, and then the worst part is that I run up a hair to pull. And so I'm Chin Fang. I'm a professor at Department of Engineering Physics. I'm presenting you some idea about endoscopy. So in the US and Canada, about 20% of the population that suffers from gastric reflux and heartburn. And about 20,000 people that will be diagnosed with esophageal cancer every year. And among them, 20% of them won't survive. Oh, sorry, only 20% of them will survive after 5 years. So the 20 is not a number that is very good here. And one of the problems is that the current standard of diagnosis and treatment of esophageal cancer is using endoscopy. But the precancerous cells are invisible to the eye through an endoscope. Therefore, that you have to do a biopsy, and then diagnosis is made by a pathologist. Then the gastroenterologist will go back and see the patient and then try to find the precancerous cells and then remove them. And you can see, because of the cancer cells are actually invisible, that there are a lot of them are missing in this process. Therefore, that we have this 20% success rate. So in our team, that we try to propose an idea that we build an integrated seek and treat approach that will result in an autonomous endoscope. That in this endoscope, we can use advanced functional imaging to automatically detect and identify the cancerous lesions and use ultra-fast, high-intensity laser pulses to kill those cells in the same procedure. And in this process, that we first try to build a robotic autonomous endoscope that can integrate ultra-fast laser pulses in there, and for both imaging and for diagnosis. And the second step is we'll try to develop advanced AI and machine learning algorithm to do this type of classification in real time. And the last step will be that to try this technology both in vitro and also in an animal model. So this team has interdisciplinary team members, including gastroenterologist, Dr. Dan Armstrong, and pathologists, and AI researchers, and optical engineers like me. And if successful, that we hope that we'll create an endoscope that can improve the odds of 20% to 90% of all, or higher, just like what the Dean gave to us. Thank you.
Thanks, Dr. Fang. If I put your proposal in layman's terms, I think it means that a patient might only have to have one visit or one procedure as opposed to two, which could potentially result in significant health savings for the healthcare system. I know it's early, but have you thought about how to articulate that potential savings to your payer, which I assume would be the health system or a hospital?
That's actually a great point, that one of the, besides that is a better treatment, and the saving to the health system is actually one of the perceived benefits. And it's hard to predict actually how saved money can be actually used and in some way. That would be probably a question that we have to ask our industry collaborators that, and also that OHIP.
How more broadly applicable is this, for example, colon cancer?
Great question, because I run out of time. And one of the next step will be actually applied to colon cancer. And one of the problem that with colon cancer is the colon is stretchable compared to esophagus. So it's the easy point, that's what we always want to do. The lower hanging fruit is actually esophageal cancer, which start to do not stretch. Well, the next step that as the technology become mature, and we really want to do a colonoscopy that as the next step.
Chin, thank you very much.
Thank you.
Zainab Hosseini Dost, Refocusing Cancer Immunotherapy. Zainab.
Good evening. So you've probably all heard the news. This year, the Nobel Prize for Medicine was awarded to research on immune therapy, and well-deserved. Immune therapy is a true revolution in cancer treatment. It works by boosting your immune system, so your body's natural defense to fight cancer. It has been called a miracle cure. Now, what some of you might not know is that this miracle cure fails for 80% of patients with a solid tumor. It's a chilling figure. For those 80%, cancer is still a death sentence. But why? Let's back up for a minute. There are two types of immune drugs. Type 1 are in the form of whole immune cells, and they work wonders, but only for blood cancers. For every other type of cancer, we have to use type 2 drugs. These are not whole immune cells, but simple immune molecules. Their job is to activate your own immune cells to fight cancer. These are the drugs that fail for 80% of the patients. The reason? Well, the sad truth is that one of the first things cancer does is it builds a wall and kicks out your immune cells. Think of cancer as a desert. It's hostile, inhospitable. No one wants to go there. But we have a solution. What we want to do is refocus the immune system to the site of the tumor so that it can do its job. And we do this by making the tumor environment more attractive for the cancer cells. For the immune cells, rather. Think of this as putting casinos on that desert. All of a sudden, you transform a barren desert into a bustling city like Vegas. So, how do we do this? We want to design molecules that I'm going to call focusing molecules. Think of these molecules as a chain with 2 hooks on each side. One hook latches onto the tumor, while the other one binds and activates the immune cell. Of course, we need a lot of these molecules around the tumor, so we're going to pack them up inside nanoparticles and send them off to the tumor site. Our focusing molecules can be used both as standalone immune drugs or be administered along with the current immune drugs on the market to boost their efficiency. My name is Zainab Hosseini Doust, and along with my collaborators, we work towards a brighter future, a future where cancer is no longer a death sentence for anyone. And who knows, one day we might even bring another Nobel Prize to McMaster. Thank you.
This looks like an initiative that actually requires quite a bit of capital beyond 100K. Can you talk a little bit about sort of the plans beyond that? Because, and how much can you actually accomplish with the first 100K to kind of prove that you've got enough to justify?
Great question. So the core technology or the core knowledge here that we want to develop, I'm going to go back to the analogy of the focusing molecule with the chain and the hooks. Now these hooks are actually very specialized molecules. These are what we want to develop. It's not trivial to put 3 functions or 2 main functions on the same molecule. That's what we want to achieve with the 100K. In fact, so we have talked to companies, but in fact, one of our collaborators actually does have an immune therapy company. He is very much in touch with the industry in that part, but we need to develop the knowledge first. That's what we're going to develop with the 100K. And it's true, it does require a higher capital than the 100K, yeah.
Thank you. 80% is a staggering number, and I'm sure it's caught everyone's attention worldwide. How many other operations and labs around the world at great hospital teaching universities are doing the same kind of research, and what makes yours different?
Right. So there is a lot of work being done in this area. However, most of the work is currently focused on developing biomolecules, namely antibodies. Now, with antibodies, it's extremely difficult to pack multiple functions on the same molecules. Engineering antibodies is difficult. That's from the research side. From a patient's point of view, antibodies end up to be extremely expensive. They have a very limited shelf life. So again, that just breaks the bank. What makes our technology different is that we're working on synthetic molecules. In fact, again, I'm going to go back to the analogy of the chain and the hook. We're going to develop these hooks using a method, a technology called phage display. So we're going to screen for molecules that bind to immune cells. And incidentally, phage display also won a Nobel Prize this year for chemistry, so our big idea really packs a punch.
Thanks.
I hope I answered your question.
Thanks, Zainab. Mike Noseworthy, revolutionizing clinical lung imaging.
Thank you, Ishwar. Okay, hey, we're having a great day here, great evening. Just everybody, just take a big deep breath, eh? Just feel all that air going into those lungs. Just think about this. You do that about 23,000 times a day. You don't really think about it, do you? I don't. I just breathe like whatever, right? But just think about this. Suddenly, out of the blue, no apparent reason, you start feeling like someone's standing on you or like you're drowning. All of a sudden, you've got some sort of acute response of something happening in your lungs. What are we going to do about it? What are we going to do for you? I'm Dr. Mike Noseworthy. I'm a professor of electrical engineering, and I've got 22 years of hospital experience as a biomedical engineer and a medical physicist. I know what I'm doing in terms of clinical work. So here's the situation. Asthma and other lung problems are on the rise for various reasons. Could be environmental allergens, all kinds of things. We know they're on the rise. And what do we do with these people that have asthmatic problems or other things like obstructive pulmonary disease? Well, we give them a bronchodilator. We call them puffers, right? We tell the kids, here, take this puffer. And what the puffers do is they dilate those lungs, those airways, to hopefully get air into the lungs. Well, that's great. They work a lot of times, but oftentimes they don't. And we have to change the type of puffer. We have to change maybe the drug that's in the puffer. We have different things. What if and they fail too. And then what do we do? We're kind of stuck. We need to go to diagnostic imaging. And imaging can give us a real picture of what's happening down inside those lungs. So, for example, we'll image someone with a CT scan. Well, that's great. Great images, but X-ray dose, it's not that good for children, because with children, we don't want to be dosing them with X-rays too often. So we've developed some new technology called hyperpolarized xenon imaging using MRI. So MRI just uses magnets and radio waves. It's non-invasive. It doesn't cause cancer, potentially cancer, like a CT scan do. Now you might be going, well, what the heck? So hyperpolarized xenon MRI. Hyperpolarization ramps up the signal by like thousands of fold, so we can do really, really snapshot imaging and get images like this one here on the bottom. We're already going for Health Canada approval with this technology with my colleagues who are from respirology, Dr. Param Nair at the Firestone Institute at St. Joseph Healthcare, and Sarah Svenningson. So we're already on the way to Health Canada approval. But what's my big idea? That image isn't good enough for me. The RF coils developed for that were developed in the 1980s. That's old. I can build a front end of the MRI that's going to be way better signal. We'll get faster information, better clarity. And we can make, because it's non-invasive, we can make big databases of lung images and use machine learning to probe, will this dose work, will this drug work, and predict responses and do better treatments. And at the end of the day, we can get rid of CT and breathe a lot easier. Thank you.
Thank you. So do you see this being able, so MRIs are used for other areas of the body. Do you see this being able to, if you're going to change the MRI, can you use it for better scanning of other parts?
Absolutely. We're doing that all the time in my lab. We're already developing a lot of the RF technology for other purposes. And it could be lungs. We're doing work on the legs. We do a lot of brain work. And we're developing not only the RF technology, but also the computer programs called pulse sequences to run the machine in different ways, faster ways, and with better, more detailed information. Yeah. I should have said I'm the director of an imaging research center at St. Joe's. Yeah.
All right.
I guess it was clear.
It was crystal clear, man.
Thank you. Thank you.
Heather Sheardown, gene editing to prevent vision loss.
We've all heard of genetic engineering, be it on television or in the movies or in the news. We might think of it as a way to create a theme park for dinosaurs or a treatment for some host of diseases. Genetic engineering has actually experienced a renaissance in the last couple of years with the development of CRISPR. CRISPR is a very precise gene editing technique that was lacking before in our toolbox. With CRISPR, there came a promise. The promise that gene therapy and gene engineering would actually become a treatment. But this hasn't happened. For the most part, with the exception of a few sporadic successes, gene therapy and CRISPR have failed and have not reached their promise. I'm Heather Sheardown. I'm a chemical engineer, and I'm also CRC chair in ophthalmic biomaterials. And what the crux of our big idea is to solve this problem. So what's the problem with genetic engineering? The problem with genetic engineering is delivery. We have to get the gene inside of the cell. And if we can't do that, then we can't alter the genome of the cell. So what we're going to do is we're going to take our delivery systems that we use for treating ocular diseases and apply those to delivering CRISPR to the cells. So while we hope that these systems would be able to treat diseases throughout the body, we're eye experts. So we're going to start in the eye. And we've chosen glaucoma as our first target. Glaucoma is a progressive, blinding disease that affects patients of all ages. And what we believe is that we can take our genetic delivery system and alter the genes of ocular cells in order to either prevent the progression of glaucoma or actually cause the regression of the disease in these patients. I work with Dr. Judy West-Mays, who's an ocular geneticist, and together we are able to take our technology from the bench to the preclinic. We have all of the expertise to be able to do that. We also have expertise in the commercialization of technologies, and we'll build on this commercialization expertise to take this technology into the patient. There's huge potential for genetic engineering and for CRISPR. And with our technology, we will first apply this to the treatment of glaucoma and other ocular diseases, and then use it to treat patients with a whole host of diseases who have been waiting for treatments for so long.
Great pitch, Dr. Sheardown. You mentioned the research continuum of taking it from the bench to the preclinic, and then ultimately, I'm assuming you would move that into clinical trials. Can you tell us about your industry relationships? I would presume that you might need some input to really parlay that into the clinical setting from a market partner.
Absolutely, and we actually are working with a bunch of different partners right now in order to translate our ocular drug delivery systems into the clinic. So we would foresee that we would be able to use these partners and their expertise in order to translate our genetic engineering systems into the clinic.
So CRISPR has been talked about quite a bit in the last few years, and you know, we see tons of companies and also sort of research initiatives around that. So the problem that you identified of sort of delivering it to the right cell, that's also been kind of documented. What are the other approaches that are kind of different than what you're doing, and you know, are there other approaches? Because it's been a kind of a well-known problem at this time.
It is a well-known problem, and you know, there are other approaches. I think that that using a polymeric delivery system, for example, like the one that's shown on that slide, would allow us to get the gene into that location, but also would protect the genetic material from the environment around it and allow it to get functionally integrated. We can incorporate things into that material that would target the cells that we're interested in, for example.
Heather, thank you very much.
Thank you.
All right. So now we have a 20-minute break because the judges are going to deliberate on the research proposal, Seeding Big Ideas. So for those of you watching live stream, please don't go away. Don't close your browser. Stay tuned. We'll be back in 20 minutes. Get a pizza or something, whatever it is, on the microwave. And everybody here, just stick around. I think so.
Yes. Yes, you have a table set up downstairs.
I think you have an escort. So John, Preston, and we've been seeding several of these projects for a number of years. 50,000 here, 20,000 there, so you're talking, yeah. Lorna, this is my investment in the Brighter Worlds Research Initiative. How's that? $1 million almost.
Start because we're running late.
Okay, but Stephen has to be. Yes, Stephen. Well, welcome back. We're ready to start. So the rules are that we sit and we don't move when the presenters are presenting their various pitches. So right now we have a video to show you. So a reminder about the People's Choice, and we'll put up a slide about the People's Choice, where you can go. Vote early, vote often. We're going to have that slide. There you go. So vote for your favorite finalist, swiftpolling.com, and enter N1954. So somebody said something about 1967 at one point. I can tell you, I wasn't born in 1954, but just by a hair maybe. And now it's time to hear from our students. I'd like to invite our undergraduate students to the stage to share their big ideas, starting with Jessica Track, Medinote. She's from electrical and biomedical engineering, 5th year. Jessica?
Good evening, everyone. Today I'm here to talk to you all about, patient education. I want you all to imagine that what I experienced just now is exactly what a patient may be experiencing. Walking out of a clinic, thinking, trying to remember, and then simply forgetting exactly what their physician advised them to do. At their next follow-up, the doctor asks them, "So, how have those supplements been working for you?" And then the patient goes, "Oh, so that's what you told me to do. I couldn't read your notes. I'll try again next couple of weeks and let you know next time." The cycle continues, valuable medical time is wasted, patient health deteriorates. Unfortunately, this happens more often than you think. And one study actually shows that patients forget roughly 50% of medical advice shortly after leaving the doctor's office. This problem is called patient adherence, the degree to which a patient correctly follows medical advice. It's a common and, you can imagine, costly medical challenge and affects people of old age and also poor cognitive function. So there's a need for technology that better improves the use of medical resources, saving us physician time and, more importantly, improving patient health. My name is Jessica Track. I'm a final year electrical and biomedical engineering student, and I have a solution to this problem. I propose MetaNote. It's a simple mobile application that acts as a diligent companion for patients to bring with them to their medical appointments. With physician consent, the patient can use MetaNote to record patient consultation. And the power in this application lies in the fact that it can take physician advice in speech and transcribe it into text. And then this transcribed text will be fed into an algorithm that can detect key phrases from physician advice, such as take pill, morning, empty stomach. So now instead of physician advice being stored loosely in the patient's memory, it's stored safely and objectively in MetaNote for the patient to review and also to share with their family. So imagine you're moving halfway across the country and you can no longer accompany your dependent mother, father, or grandparents to see their physician. Instead of calling them up and trying to communicate with them on how their appointment went or on details that they may have already forgotten, they can just open up MetaNote and press send and have it update you on their treatment. The implications of this idea is huge for our healthcare system. It has the power to optimize patient consultation, improve patient health, and bring reassurance to families of patients. Thank you very much.
Thank you, Jessica. Natasha Varghese, Predicting the Unpredictable. She's from computer science, third year.
As of June, approximately 68.5 million people are forcibly displaced from their homes due to violence. We are living in the worst refugee crisis since World War II. From Syria, South Sudan, and Myanmar, people are forced to take perilous passages through oceans and mountains and deserts in order to escape. There is no safe passage, no exit strategy anywhere, because no one saw these events coming, and no one could plan accordingly. I remember learning in history class about the red flags that precipitated these events: a change in political party, past economic or territorial grievances, a surge in propaganda. Yet, even with all this knowledge, the most educated people in the world still fail to predict that these events will happen. But what if a computer could? Hi, my name is Natasha, and my big idea is an application called SafeWorld that utilizes predictive analytics to ascertain when and where the next refugee crisis could occur. Predictive analytics is a field of study that utilizes past and current data to make assumptions on the future. It's comprised of machine learning and data mining. Machine learning is the idea that a program can be automated to enhance its performance given a trained set of data, and data mining is the idea that we can find patterns in large data sets. You might be thinking, this seems like science fiction or a prerogative of the distant future. But you'll be surprised to know that machine learning was first successfully implemented in the 1990s with the advent of your email spam filter. And since then, these applications have become more precise and more advanced, with companies and sole programmers alike creating applications that can predict stock prices, natural disasters, and even election outcomes. SafeWorld would take in everything from a country's currency value to wealth distributions to political party trends in order to ascertain whether a mass influx of people might leave a certain location at a specific time in the future. This application could be used by both governments and humanitarian agencies alike to create evacuation plans, ceasefires, and resettlement plans in a timely manner instead of reactively. This could not only save lives, but help bring peace to conflict-ridden areas faster. Companies have learned how to use these applications to predict what a consumer may want to buy in the future. We've learned how to invest in money, so how about we learn how to invest in lives? Thank you.
Hannah McPhee, Making Emergency Response Safe, Engineering Physics, fifth year.
Every day, firefighters respond to building emergencies. Some of them are small, like anytime someone in my residence tried to make popcorn, but many are serious and life-threatening. In the case of these large building emergencies, firefighters have to do complete and systematic searches of every room in the building to make sure that they're safe. But before they enter the building to do these searches, they often know very little about what's actually going on inside. They might know where the fire started, because they can identify what zone of the building the fire alarm was activated in. They might have a paper floor plan or some structural information about the building from inspections. But what they don't know is crucial information about what's going on in the building in that moment. How has the fire progressed since it started? Is the floor plan that they were given actually accurate? Are there people in the building? And if there are, where are they? This information is essential for helping firefighters do their job safely and helping them get people out of the building as quickly as possible. This is our priority, since we know that the majority of fire-related injuries and deaths actually occur from prolonged smoke inhalation, not from the fire itself. This is why my capstone group and I came up with the idea of FENRIS, which is the Fire Emergency Response Information System. FENRIS is a network of sensors that will be installed in a building the way a typical fire alarm system is, and connected through a Bluetooth mesh network. In the event of a fire, the system is activated and immediately begins to scan the building, collecting information that can be accessed by the fire department when they arrive on scene. FENRIS uses smoke and temperature detectors to identify what rooms in the building are unsafe for people and track the progress of the fire throughout the structure. Each sensor is equipped with a visual camera, and we use image processing to identify where exits are in each room, and coupled with passive infrared sensors, which identify heat signals, we can also identify where people are in the building. FENRIS processes all this information and generates a smart floor plan and an optimized building search plan that puts rooms that are unsafe for people and rooms that have people in them first, to allow emergency responders to get people out of the building as quickly as possible. At a cost comparable to that of conventional security systems, FENRIS can easily be installed in a new building in place of a fire alarm system or retrofit into an old building to supplement their safety systems, making it an easy and accessible way to make our buildings safer and our emergency response smarter. Thank you.
Yamna Irfan, Melatonics. She's from Integrated Biomedical Engineering and Health Sciences, second year.
Imagine having cancer and not even knowing it. Around 90,000 new melanoma cases are diagnosed each year, and 9,000 of those people are expected to die of this very curable cancer. Why? Because of late diagnosis. Melanoma is a dangerous form of skin cancer that appears as moles on the skin. And it's often hard to detect because people don't check for changes on their skin or actually know the symptoms. My name is Yumna Irfan, and I present to you Melanotics, a website and an app that can revolutionize prevention and early detection of melanomas. It allows a user to take a picture of their mole and determines the risk of it being a melanoma. Yes, it is as simple as downloading an app on your phone or pulling up a website on your computer. As you can see over here, it uses a machine learning algorithm to check for distinct melanoma features. For example, a rough surface, asymmetry, and more than one color. And in the case of this melanoma, the website gave a result of it being an 88% risk, and also prompts the user to go visit their doctor immediately. In contrast, if it's just a regular mole, it gave a risk analysis of 1%, easing the user's mind. The algorithm was trained with using over 200 pictures of melanomas from different hospital databases, making it 92.4% accurate. Right now, Melanotics can just do this, but in the future, it'll be able to track progression over time and see if that mole is getting bigger. Because one of the greatest signs of a melanoma is that it's evolving. Humans, even doctors, can't tell if your mole is a millimeter bigger, but a computer can. Melanotics is a very quick fix, wherever, whenever, and it empowers you to take charge of your own health. Thank you.
These were undergraduate students, and now we move on to our graduate contestants. Vincent Lung, breaking the cold chain, creating thermally stable vaccines PhD candidate in chemical engineering.
Good evening. My name is Vince Leung. I'm a PhD student in chemical engineering here at McMaster University. Vaccines are essential for global health. Every year, 2 to 3 million lives are saved because of vaccines. Here in Canada, we're very fortunate that we have easy access to vaccines. I'm sure many of us here have been vaccinated at some point in our lives. But that's not the case for many people around the world. In fact, 19.5 million children under the age of 1 today do not have access to basic life-saving vaccines. And 1.5 million people die every year to preventable diseases simply because they have no access to immunization. One of the greatest challenges for global immunization is the need for a refrigerated supply chain, or what we call a cold chain. Almost every vaccine that are available on the market today require refrigeration, or else they lose their efficacy and must be discarded. This presents a tremendous logistical problem because many places in the developing world do not have access to reliable electricity to maintain this cold chain. And it's also a financial burden because to maintain the cold chain, it could cost up to 80% of the total cost of a vaccination program. For my PhD thesis, we want to address this problem by creating thermally stable vaccines that do not require refrigeration. And how we did this was we used 2 FDA-approved sugars. One is called Pullulan, the other called Trehalose. And we mix these sugars with the vaccine, and we dry the vaccine into a water-soluble film. And we tried this for 2 types of vaccine. One is for HSV, the other for influenza. And what we did was we took these vaccine films and we stored at 40 degrees Celsius for 3 months, and we performed an in vivo experiment where we administered these vaccine to mice and exposed the mice to a lethal dose of the infection. Although we stored the vaccine at 40 degrees for 3 months, what we found was that these vaccines were still able to protect the mice from the infection. This is excellent results because it shows that we can maintain the efficacy of the vaccine without the cold chain, even at elevated temperature. Imagine a brighter world where everyone has access to life-saving vaccines and no one has to die from preventable diseases. That's what our research is striving for. Through our vaccine films, we're taking it one step closer to making that brighter world a reality. Thank you.
Sam Peter, solar windows, a clear alternative. He's pursuing his PhD in engineering physics.
Those blue solar panels have become ubiquitous to our everyday lives. You see them on your way to work, you see them around Mac, heck, you might even have one on your own roof. The one place you're less likely to see them is somewhere like downtown Toronto. As we make our buildings taller and taller, the roof space where you might find solar panels is small compared to the sides of the building, and that's a lot of wasted surface area. But it doesn't have to be that way. If you could make those windows fluoresce, then a portion of the sunlight hitting them can be converted into lower energy infrared light, which you can then trap and concentrate on the edge of the window. And if you put solar cells on those edges, well, now you've got electrical power. Now, this isn't a new concept. In fact, it forms the basis for the emerging field of building integrated photovoltaics, which relies heavily on the use of fluorescent plastics. My work aims to improve on this concept, but not using plastics. See, plastics tend to break down when exposed to UV light. So if your application is a window, well, it's kind of a terrible choice of material. Instead, we've developed a fluorescent nano ceramic. Tiny crystals, roughly 1,000 times smaller than the width of a human hair. Way smaller than what the eye can see, meaning the window remains transparent. And as a ceramic, it has the potential to be stable for decades. The use of infrared is also important to the design because in terms of energy, it's too low to get reabsorbed by another tiny crystal on its journey to the edge of the window. And because it's outside the range of what the human eye can see, there's no color or tint in the final product. a key aesthetic, because the best designed windows are the ones that make us forget they're even there. My work aims to bring clean solar technologies to high demand areas that have been deemed too impractical. And I hope I've made that as clear as my windows. Thank you.
Eva Mueller, Smart Materials for Drug Delivery, pursuing her PhD in chemical engineering.
Pills, liquids, needles, patches. There are all kinds of ways to get medicine into our bodies. But what if? What if you could change or find a new way to deliver those medications to people? By being smart, intelligent. We already know what it means when someone is smart. But do you believe me when I say that materials can be smart as well? Smart materials are materials that respond to their environment. They have the ability to change their properties when external stimuli are applied. Stimuli such as temperature, light, and ultrasound waves, among many others. These are all attractive for controlling the release of drug in the human body. Good evening. My name is Eva Mueller, and I'm a PhD student in the Department of Chemical Engineering. I've developed a novel method of fabricating smart particles of the size of less than 1 micron. To put this into perspective, my particles are 50 times smaller than the width of a human hair. With particles this small, I'm able to localize and specifically target the release of drug by fine-tuning their properties. My particles have 3 main properties. 1, they're smart. They're able to change their size in response to temperature. They decrease in size when exposed to body temperature, allowing for drug to be released. They can also be reverted back to their original size at room temperature. This process is very similar to squeezing that kitchen sponge, allowing for all the soap to come out. 2, my particles are little reservoirs of drug. They can control the speed at which drug is released into the body, meaning you don't have to take your medications as often. 3, my particles are degradable. They can be broken down into components that the body, especially the kidney, can easily process, so they don't stay in your body forever. My ultimate goal is to expand this set of smart materials and perhaps permanently change the way we will be delivering medications to millions of people in the future. So tomorrow, when you may regret drinking those 8 glasses of wine at tonight's dinner, consider this when reaching for that Advil. One day, that Advil may be smarter than you. Thank you.
Well, that's only my second beer, and I didn't finish my first one. Andrew Leclerc, Measuring Knowledge. How do we know what a computer knows? Andrew's pursuing his PhD in computing and software.
So what is it about doctors, professors, and lawyers that has us call them knowledgeable? Part of it is that from years of education, that they have an extraordinary understanding of their domain. But so do textbooks, and we don't call those knowledgeable. What sets those doctors and lawyers apart is their ability to learn. When you give them data, they leverage their understanding of their domain to generate new facts. These facts are what we call knowledge. And ultimately, we want our computers to be just like these doctors and lawyers, and that they understand a domain that they can learn from. But how do we get there? So my name is Andrew Leclerc, and in my PhD, this is a major question that drives my research, is how can we characterize what knowledge is to a computer and thus generate it? If the goal is that we wanted to generate that knowledge, we needed to first understand that domain. Imagine you wanted to learn about medicine. It should understand it as though it's every top doctor, nurse, and health scientist combined. But how do you get a computer to understand something? You can't just lecture to a computer like you do a student. we require a language that we both speak. And this happens to be math. In my research, we use specific types of math to achieve this understanding with algebraic structures. These structures, they allow us to formalize what it means for a computer to understand something, and thus, what knowledge is. But that's not all. Using specific properties and theorems, we're able to formalize and further characterize what knowledge is by distinguishing between ideas such as inductive and deductive knowledge. We can even define a function which measures how much a computer will be able to learn at a discrete time step. We're measuring knowledge. And we can also go further than this and say that this function has a fixed point. What this fixed point means is that given the current understanding of the domain and the data that the machine has, there will be a point where no new knowledge can be generated, that it actually caps out. But I want to go past this. I said that we use the data to generate these facts. And in today's world, there's just an overwhelming amount of data. To expect a computer to efficiently utilize all of this data and still reason, that's unreasonable. And so, what I want to do is I want to take advantage of the fact that computers are great multitaskers. I want to take this algebraic structure and break it down into parts so that we can do this learning in parallel. But what does this do to the knowledge that we acquire? Can we still learn the same things after we break this structure? And if not, what do we lose? Can we quantify it and measure it? There's so much to explore with this, and I'm hoping that by being able to better discuss and quantify what knowledge is to a computer, we're one step closer to having machines that can learn. Thank you.
Thank you very much. This is the end of the program. Our judges will now take a short break, 15 to 20 minutes, and they'll deliberate. And after that, we'll find out who gets what. Well, everybody walks away with something tonight, so. But, there's one award that depends on all of you, and that's the People's Choice Award. So vote for your favorite finalist tonight. What do you have to lose? Like I said, vote early, vote often. If you don't do that, Andrew's already got some kind of computer algorithm that's just punching his number. So we break now for about 15 or so minutes. We can just.
Yeah, let's do this. Yeah, these are the gift bags. I don't
Yeah.
do you want to recognize the,
This is
that's John. Yeah.
That's John.
Do you want to do the judges to
Yeah.
say just thank you to
Yeah,
them?
yeah. What's here? Books?
Books, beautiful, yeah, the book, the pen. Business card holder. There
Ah.
is, I think, a water bottle of
Right.
some sort. Do you like the artwork?
I love it. I saw it. Monique showed me. Okay. All right. Ladies and gentlemen. Ladies and gentlemen, we're about to commence the program again. Please be seated. The list.
They're coming out.
Well, I'm waiting for the results, which is what the suspense is all about. And Arlene doesn't have them. Somebody said they are coming up, but they're being tabulated by our accountants, and that's right. And so I'm waiting for the envelopes to be verified. I don't know what the results are. I might actually flub it and say the award goes to. My 3-minute pitch. Okay, here's my 3-minute pitch. McMaster Engineering. Okay. McMaster Engineering. Okay, start again. You know, the peanut gallery is pushing.
You don't get to start again.
No, I gotta start again. Come on, 3-minute pitch.
Okay, there we go.
Off the top of my head. McMaster Engineering is the faculty you want to be proud of. McMaster Engineering is the faculty you want to belong to. McMaster Engineering is the faculty you want to send your children to. Why? Because we put students in the middle of the learning process. What we say is no students, no paycheck. McMaster is a higher education institution. Higher education means that students permeate every strand and thread of our academic DNA. If we teach, it is to teach students. If we teach students, it is to ensure that they have the best outcomes. And for that, we say that we educate citizen scholars who will transform the world. Why do we say that? Only 27% of all engineers in Canada, including from McMaster University, become engineers. 73% will go on to do other things in life. Of course, we teach them engineering. We teach them technical depth. But we teach them to be citizens, to be scholars, and to transform the world. We do research because of that. Our research is not only to create a brighter world, but our research is to educate citizen scholars who will have that sense of discovery. They'll be able to pivot because we've given them design thinking. We've taught them through experiential learning, learning by doing. We've given them research opportunities so that through discovery, they can solve open-ended problems. And we also teach them to be innovators and entrepreneurs. We teach them to realize who their customers are, to empathize with those customers, and to build great solutions. Customers is not a cheap word. If somebody creates an NGO that caters to refugees, they know who their customers are. We know who our customers are. Our customers are society. Our customers are our students. We educate citizen scholars who will transform the world and make it into a brighter. They'll make it into a. Thank you very much. Any questions? Any questions? How was that for timing, honey?
Perfect. 2 seconds left.
Hey, all right. Okay, so I have the People's Choice Award first.
Yes, which is Tohi.
Okay. So, the People's Choice Award, that's just like a psychic award, you don't really get anything? Oh, we do have a small, how small is it? Okay. So this is actually a very large token of appreciation because it has a schematic of which building, the historical building, which is the John Hodgins Engineering Building. There are very few of these tote bags in the world. I don't want to see them on Etsy or eBay. They're very precious. The People's Choice Award goes to Dr. Sorry, undergraduates, graduate students, Tauheed Didar.
Thanks very much.
Thank you.
I should get the Oscar for acting in the video as well, but
Okay, it's done, man. Oh, we can do a photo, yes. He's a talkative guy. Congratulations. So, the undergraduates next. So we go through. Okay, thank you very much. I have to. You know, deans never do any work, they have people. So I'm asking my people, what do I need to do? So, first we announce the winners of the undergraduate pitch competition, and we'll go 4, 3, 2, 1. So I'm pleased to announce that our third runner-up in 4th place is Natasha Varghese. Natasha? Congratulations. Thank you. Yeah? Okay, we're good. Our second runner-up in 3rd place is Jessica Track. Jessica? Congratulations. Our first runner-up in 2nd place is Yamna Irfan. Congratulations, you did well. And so by a process of elimination, our overall winner is Hannah McPhee. Hannah. Congratulations. You win $1,000. She's in engineering physics. All right. Thank you. Let's all come up. Hannah, just say it right here. Yeah. Could you, like, for your parents, like, they're paying way more than what you got. This is a small token of our appreciation for the tuition dollars. Go ahead. Thank you. We move on now to the winners of the graduate competition. And again, we'll go 4, 3, 2, 1. The third runner-up is Andrew Leclerc. Andrew. Congratulations. The second runner-up is Ava Mueller. Congratulations. Thank you. The first runner-up in second place is Sam Peter. Congratulations. And again, by a process of elimination, the winner tonight is Vince Leung. Look happier, Vince. Come on. It's like $3,000. Okay, thank you. Come on. Come on, everybody. What's that? What's the tax rate on that? I don't know. He's in the 52% bracket, so. Because we compensate graduate students really well, don't we? Thank you. Thank you very much. So there are two very special people who've really thought through this entire evening. Monique Beach has been the mastermind, and John Preston organized the Seeding Big Ideas competition. So I want them to come up and stand with me. We're not going to give consolation prizes, but just the 6 prizes for the Seeding Big Ideas. So there are 6 checks here. You cannot cash them at any bank. And the other 4 walk away with $25,000. So, in no particular order, it's not a rank order, right? In no particular order, then I'll just go 1, 2, 3, 4, 5, 6. What do you think? Go for it. Okay, yeah, all right, So, in no particular order, I'd like to ask Todd Hoare to come up, 3D printing of organs. Come on, yeah, thank you. Just stick around. Tauheed Didar, tackling food waste.
Thank you.
You can certainly keep that. You know, I want you to frame it. It's got my signature, and you have no idea how much trouble they went to get a signature that wouldn't pixelate. It was high profile, etc. This is a saga. I mean, I don't want to see it like behind your chair or something, you know, just in the corner. And I certainly don't want you to use the opposite side of that as like a tack board. No. Thank you. Okay. Smart Surfaces for Combating Antibiotic Resistance, Catherine Granfield. Congratulations, Catherine. Multi-scale computational predictive tool for cancer metastasis, Zara Mutamed. Refocusing cancer immunotherapy, Zainab Hosseini Dost. Congratulations. And finally, Center for Printed Electronics, Igor Zitermisky. May I ask all 10 of the winners? Okay, Monique says no checks, just leave your checks behind. They're too valuable to bring on stage. Give your checks to Hanny, yeah. But may I ask all 10 winners, because everybody's a winner, everybody gets something tonight to come on the stage for a group photograph, so congratulations to everyone. Thank you very much. Thank you. So now I'd like to thank John Bandler for helping to organize this event and for offering coaching and advice to our contestants. The story goes that Monique had a conversation with John Bandler. John came to my office and he said, why don't we have this 3MT competition for graduate students? And I said, well, how about undergraduates? And he said, oh boy, that'd be wonderful. I said, how about faculty members? And he said, that'd be great, but how are you going to pull that off? Here you go. It all starts with a big, come on, let's do it again. It all starts with a big idea. John, thank you very much. We have a gift for you. I understand there's some cufflinks. Do you have a French cuff shirt? Yeah, okay. Well, then we have cufflinks for you. Otherwise, I have 2 or 3 French cuff shirts, but I don't have blue cufflinks. I don't know which color they are, but
we'll find out.
Okay.
Thanks so
Thank
much.
you very much.
Thank you.
Thank you. We'll have a John, I think your wife Beth is taking a photograph. And maybe you want to turn the McMaster
Oh yeah, good
symbol.
point.
Yeah. Because
But it's on both sides.
Oh, wonderful.
It's two-sided. That's it.
Okay.
Okay.
Thank you.
Thank you.
So I want to offer special thanks to John Preston, Steve Hrnanovic, and Colin McDonald, because there was a night before this. On Tuesday night, there was a pitch night for undergraduate and graduate students, and thank you very much for helping to organize it. I want to thank our outreach team. I've thanked Monique. She was an architect of this. But Sarah Lindstedt was instrumental in all of the logistics. Sarah's also getting married in a couple of weeks. And so we only thought that it would be nice to sort of, recognize her, give her a little gift. Sarah, you around or? Where is Sarah? Come on up. There you go. Come on, Monique. Come on. Oh, here you go.
Thanks very much.
Thank you.
Appreciate it.
Thank you. And now, a special thanks to our judges for taking the time for being with us tonight. Stephen, I thought he'd gotten bored and just flown away on his jet. But if you could join me on stage, we also have those really nice bags for you. They're very valuable, one of a kind. You can't get them at Hudson's Bay. Here you go, Katie. Thank you so much.
Pleasure. Thanks for having me.
Nitin, thank you so much.
Thank you.
Thank you, Lorna.
Thank you. Pleasure.
Angela, thank you very much.
Thank you.
And Stephen. Thank you very much. Let's get a little photograph going. Thank you. So, the bummer of an evening like this is I just get to spend. It's like a wedding and I don't get anything. Anyway. Maybe I pitched. Well, for those of you who are on live stream, thank you for being with us from McMaster University in Hamilton, Ontario, Canada. Wonderful things are happening here. We're going from good to better to best. And for all of you, thank you for joining us. Have a good night.